You ready, Dr. Seidlinger? You ready, Dr. Edwards? Okay. You ready? Ready? Okay. Good morning. Thank you all for joining us today. I'm here with Dr. Renee Edwards, Chief Medical Officer at Oregon Health Sciences University and a member of my medical advisory panel, and Dr. Dean Seidlinger, our state epidemiologist. It's been 100 days since I announced Oregon's Stay Home, Save Lives order to reduce the spread of COVID-19 infections. When I first declared a state of emergency due to the coronavirus on March 8th, a little over 16 weeks ago, there were 14 cases of COVID-19 in Oregon. Today, there are over 8,600 cases, with more than a quarter of those cases identified in a 2-week period in June. At this pace, we could reach 10,000 cases within a week. Less than 6 weeks have passed since the first Oregon counties began their gradual reopening process. And today, Oregon, you have a choice that only you can make. What happens next is up to you. It's up to each of us. Do we wear face coverings, keep a physical distance, and avoid large gatherings? Do we protect ourselves, our families, our grandparents? Or do we pretend that this virus isn't hiding and lurking among us? Do we pretend that we're somehow immune because we have not gotten sick so far? Do we pretend that it's no longer an invisible killer? There is absolutely no question. Oregon has been a leader so far in fighting this pandemic. In the months since we've discovered Oregon's first cases of COVID-19, we've shored up our supplies of personal protective equipment and hired contact tracers. And despite the failures of the federal government to supply Oregon with an equitable amount of testing materials, we have expanded our statewide testing capabilities. We've also made tremendous sacrifices. Graduation ceremonies canceled, weddings postponed, business shuttered, jobs lost. By staying home to save lives this spring, Oregonians prevented 1,500 hospitalizations and over 70,000 COVID-19 infections. We have one of the lowest COVID-19 mortality rates in the country. And now we find ourselves at a new crossroads. The choices each of us make will decide whether we reduce the spread of the virus and find a way to keep our businesses open, or whether we let down our defenses and allow the virus to take hold. An uncontrolled spike in cases will threaten to overwhelm our hospital capacity and force us to close down businesses again. We have a chance now as we approach the 4th of July holiday weekend, a chance to protect ourselves and each other. In states like Texas, Florida, and Arizona, the disease spread and hospital emergency rooms are now flooded with coronavirus cases, and now they're closing businesses down again. What happens next is up to all of us. I've asked Dr. Edwards from OHSU to join us today to help explain why it's so important to wear a face covering, a mask, a bandana, or hand-sewn fabric to cover your nose and mouth while you're in public. But before she does, I want to say a few things about our statewide face covering requirement. The requirement has been in effect in 7 counties, and it goes into effect statewide today. Oregon isn't alone in having a requirement to cover your face when in public indoor spaces. Nearly 20 states have implemented these rules. States like Michigan, California, Washington, Nevada, North Carolina, New York, and New Hampshire. Oh, and Kansas has a face covering requirement too. The list goes on. Oregon's face covering requirement generally applies to all indoor places where the public may go. This means grocery stores, pharmacies, and shops. It means lobbies, elevators, and restrooms. It means gyms, restaurants, and churches. Anytime you might be in an indoor area with the general public, you should put on a face covering. There are, of course, some exceptions to the rules. The mandate does not extend to children 12 and under, though I am still encouraging parents to help their kids ages 2 and up wear a face covering in public to the extent that it's possible. The mandate also allows for accommodations for those who may have a medical condition that makes wearing a face covering difficult or dangerous for their health. Another exception is while you're eating or drinking in a restaurant, for example. And finally, if physical exertion makes it difficult to wear a face covering while exercising, you may remove it as long as you can maintain a distance of 6 feet from others. This is both an individual mandate and a requirement upon businesses and the owners of public indoor spaces. This is enforceable by law at both a business and an individual level. As with all orders I have issued to keep people safe and save Oregon lives, violation of the order can carry a Class C misdemeanor as a penalty. However, as with all of my orders, I do not want the local police issuing tickets. Instead, I'm calling upon our businesses to step up and help ensure that the public and their employees are protected. My agencies are working to set best practices for businesses to operate with this new requirement, and it's incumbent upon all of us to adopt this requirement. If covered businesses ignore the rule, then OSHA and other state agencies are ready, following up on complaints, and with using all the tools available to ensure enforcement. I'm very serious about this. I'm also willing to bet that Oregonians will want to frequent businesses where they feel safe. Wearing a face covering is a simple, common sense way to protect yourself and others. What an easy way to save a life. At the end of the day, the number of cases we see will be a reflection of our collective efforts as Oregonians. And my sincere hope is that these steps can prevent shutting down our businesses again. In addition to the statewide face covering requirement, today we're also launching a new public education and advertising campaign. Oregon-based ad agency Wyden & Kennedy donated their time to make this possible. Thank you. Their new ad campaign will help educate Oregonians, especially younger Oregonians, about the importance of covering your nose and mouth when out in public. We'll also supplement this effort with Spanish language advertising and outreach and ads in a number of other languages as well. Now I'd like to ask Dr. Edwards to talk about how face coverings prevent the spread of COVID-19 and save lives. Thank you, and Dr. Edwards.
Thank you, Governor Brown. It's my pleasure to be here with you today. Good morning. My name is Renee Edwards, and I'm the Chief Medical Officer for OHSU Health. COVID-19 is certainly a disease that continues to challenge us. This is hard. And now, as the governor mentioned, and as Dr. Seidlinger will review with us in just a moment, we're seeing increasing numbers of COVID-19 cases and hospitalizations in Oregon, which is raising the same concern for a surge that we were all discussing together back in March and early April. Oregonians should really give themselves all a pat on the back for the outstanding work that we all did back in March and early April, because facing that challenge, we reduced our underlying transmission rate of COVID-19 by 83% due to the effectiveness of all of our actions. We'd all like to maintain these gains that we made together. So the question is, how do we do this? Today we're here to talk about the importance of some very basic principles: wearing a mask in public, physically distancing 6 feet apart from one another, whether inside or outside, and hand washing. Other than hand washing, these are not things we routinely had to think about prior to March of this year. But now they've become the bedrock of how we protect ourselves, how we protect our family, friends, and community from infection, and how we protect our businesses and the economy. We cannot become complacent about these things. What can feel truly frustrating about COVID-19 is that there is no sure medical treatment to prevent it or treat it once a person is infected. Our defense against this coronavirus is a good proactive offense. We know that this virus is spread person to person through close contact and mostly via what we call respiratory droplets. These are the small particles that we naturally produce from our mouths and noses when we talk or laugh or cough or sneeze. They can be put out into the air where others can then breathe them in. So it just makes good common sense that simply covering our mouths and noses with a face covering or mask to serve as a barrier for these droplets from getting to others, along with standing a distance away from one another, would prevent disease spread. These droplets can also fall onto surfaces that others can touch, which is why frequent hand washing is also so important. And medical studies clearly support this. 2 studies that have been released in just the last month looked at thousands of people across several countries. Both of these show that staying 6 feet away from one another and wearing a mask or face covering leads to large reductions in disease transmission. Wearing a mask reduces disease spread, and distancing reduces disease spread, such that each of them alone is valuable, but done together gives even greater protection. Not one or the other, but both is actually best. It's also important to know that you can be infected with COVID-19 and already be infectious to others 2 to 3 days before you yourself even develop symptoms. And for some, especially young people, the symptoms may be so mild that you don't even realize that you're actually infected with COVID-19. And that's why it's so important that everyone wear a mask, even when you feel fine, because wearing a mask and standing away from people may prevent you from spreading the virus to others without even knowing it simply by talking when you don't even yet know that you're infected. Some wonder if there's any harms to wearing a mask. Well, it might cause some discomfort to have something on your face or cause some skin irritation, or as the governor mentioned, for some people with pre-existing medical conditions such as a breathing problem, they could potentially increase this breathing difficulty. And certainly it can be harder for us to understand one another when we're all speaking with masks on. But I would say that these effects are small relative to the value that we all gain by using them. A recent analysis just released yesterday by Goldman Sachs even suggests that a national mask mandate could slow the growth rate of new coronavirus infections such that this could prevent a 5% loss in our GDP. This is equal to $1 trillion. So the bottom line is that the more people you interact with, the closer you are to them and the longer you are with them, the greater your risk of either getting COVID-19 or spreading it to someone who may potentially become very ill. So consider your risk and the risk of others around you and those you live with and interact with before going out. All of you made Oregon actually the number 4 best performing state in the country this spring. That's incredible, and for this we should all really be grateful. Certainly healthcare workers treating COVID patients on the front lines of our clinics and hospitals are grateful to all of you. Now we just need to do the hard work of regaining our hard-fought fight and doing this on behalf of all of us together. Thank you.
Thank you, Dr. Edwards. Dr. Seidlinger, you want to wrap us up?
Thank you, Governor Brown, and thank you, Dr. Edwards. I want to affirm Governor Brown's decision to require Oregonians to wear masks in all indoor public places in all parts of the state. Masks work to help prevent the spread of COVID-19, and we all have a role to play in achieving that. I want to give you an overview of where we are with our COVID-19 pandemic in Oregon and why extending the mask requirement is necessary at this time. We all have to remember that the numbers I speak about are people, our fellow Oregonians. These are people who are sick, and tragically, some of whom have died. These are people with families. These people are our neighbors. COVID-19 cases are growing and increasing at a faster rate in Oregon. We've experienced 5 straight weeks of case growth in the state. COVID-19 cases jumped 20% in the past 2 weeks alone, as you heard from Governor Brown, with an increase of more than 2,500 cases. We are reporting 281 new cases today, which means almost 9,000 Oregonians have been diagnosed with COVID-19, and 208 people have died. The percentage of positive tests is increasing. Last week, 4.3% of COVID-19 tests were positive, the highest rate we've seen since the end of April. The virus is circulating more widely in our community, and cases are rising fastest in our rural counties. Sporadic cases, or cases that we can't trace back to a known source, are accounting a growing percentage of our cases. That tells us that coronavirus is circulating more widely in our community, which means more people are at risk of becoming infected and getting sick. More younger people are catching COVID-19. Last week, COVID-19 cases substantially increased for all age groups younger than 50, including children and teens. The rising number of infections amongst young children is one reason we're beginning to report outbreaks in childcare facilities starting today in our weekly report. We're seeing the fastest case growth in central and eastern Oregon counties, such as Deschutes, Malheur, and Umatilla, counties that have had the highest rates of new cases in the last 7 days. We have to remember that some of our communities are hardest hit. Our neighbors who are Black, Latinx, Pacific Islander, and Native American have borne an unfair burden of this disease. Our healthcare system is becoming increasingly burdened. Hospitalizations have been ticking up about 6% per week in the recent weeks. Right now, Oregon hospitals have adequate intensive care beds and ventilators to handle the number of cases we're seeing. But our healthcare system cannot sustain this increased growth without becoming overwhelmed. Our long-term prognosis is even more troubling. Our latest projections showed that we are on track to hit a worst-case scenario model that we had just 2 weeks ago. The most likely scenario that we're facing shows that daily COVID-19 infections could rise over the next month to more than 900 per day, with daily admissions to the hospitals increasing from 8 to 27. The most pessimistic scenario shows that our daily case counts could rise to 4,800 in the same period by the end of July. Only a portion of those individuals may test positive, and many people will not have symptoms, or they'll have mild symptoms, but they'll still be in our community and able to spread the disease. The trends are ominous. Under the worst-case scenario, hospitalizations could increase by 82 per day. 82 new Oregonians being admitted to the hospital each day for a disease we can all play a role in preventing. We use the models for planning purposes. They're not predictions, but the models show us where we're all headed if we don't act. That's why it's vital for every Oregonian to wear a mask or a face covering. Cover your face when you're in public. Maintain that 6 feet of distance. Masks and face coverings protect the people around you. As Dr. Fauci told Congress, they also protect you. We can slow the spread of COVID-19 in Oregon by wearing masks. Growing evidence tells us that masks make it harder for COVID-19 to spread. Our experience tells us Oregonians can work together to flatten the curve. We've done it once, we can do it again. We still have one of the lowest COVID-19 infection rates in the United States, despite having one of the earliest diagnosed cases, and that case was based on community spread. Together, Oregonians have stopped COVID-19 in its tracks by following Governor Brown's Stay Home, Save Lives executive order. But we all know the sacrifices that effort entailed. We can flatten the curve again if we cover our faces and continue to do the other simple things that protect us from COVID-19. Avoid large groups, especially over the upcoming July 4th weekend when we're all tempted to gather together with friends and families. Stay 6 feet away from others. Wear a mask or cover your face when you're in public. Wash your hands. You learned that in kindergarten. You need to continue to do it. And stay home if you're sick. Contact your provider about getting a test. And finally, on behalf of public health, I want to say, answer the call. If you get a call from a public health investigator or a contact tracer to let you know that you may have COVID-19 or may have been exposed, take their advice and stay home for the entire period they recommend. This is for your health and the health and safety of your family, your coworkers, and the friends and neighbors that you want to see every day. This is a tried and true public health method we use to halt the spread of disease, and we need people to answer the calls and listen to the advice. If we don't, our latest projections tell us we're risking letting the virus spread fast across our state. So remember, we all have a role. Avoid large crowds, keep your distance, and most importantly, wear a mask. Thank you.
Thank you, Dr. Seidlinger. Charles, I think we're ready for questions at this point.
Great. Looks like we've got quite a few people in the queue today, and we'll get started with Kelly Azar from K2. Go ahead, Kelly.
Hi there, Governor. This question is for you. At what point is enough enough? We saw spikes in the 14 days following Memorial Day, and they've since gone up since then, where you did ask Oregonians to stay home and not gather. Many people are planning similar gatherings for the 4th of July weekend. So what makes you think this weekend will be any different and that we won't see spikes again? Why not mandate or close down counties for the 4th of July weekend?
Thank you, Kelly. I appreciate your question. We are taking what I consider to be very serious steps toward slowing the transmission of the virus by providing a statewide mandate that all Oregonians wear face coverings when in public indoor spaces. We know that face coverings can help prevent transmission of the disease and save lives. In terms of other activities for the 4th of July weekend, we definitely saw a spread, an increase in the virus after Memorial Day weekend. And unfortunately for all of us in Oregon, the weather forecast for 4th of July looks fabulous. So I want to encourage Oregonians, young and old, and everyone in between, to keep your celebrations local, to keep them small. I know many of you have been planning a backyard barbecue bash, celebrating with 100 of your best friends. I want to encourage you and say to you that we need to keep people safe. And I want to say, please, please, please keep your backyard barbecue, your picnics down to your family household members. And wear face coverings, and of course, maintain your 6 feet of distance. At this point in time, Kelly, we're obviously watching a number of metrics, not one particular metric, but a number of interrelated factors, including the rising increase in positivity, looking at hospital bed capacity, and the amount of community spread. Those will all be taken into consideration as we move forward. Should cases continue to rise, should our hospital bed capacity become thin, then we will need to take more drastic actions. I'm hoping that Oregonians will move forward with face coverings and we can begin immediately slowing the transmission of the virus.
And if you'll allow me, I do have just one other question. You're asking businesses to enforce the mask rule, and that puts them, many of them have said, in a very exposed position for lawsuits, especially if people refuse or claim or do have medical conditions. How can you put that on businesses who are already in a very vulnerable spot because of COVID-19?
Well, I certainly appreciate that question, and we are working with the business community. We're working with state agencies on education and information before we move to enforcement. But I am asking all of us to take this face covering requirement very, very seriously. It's up to each and every one of us to protect ourselves and to protect other people, particularly our vulnerable community members. I am hoping, we know that this requirement is being imposed in over 20 states across the country. Businesses have a number of regulatory requirements that they need to comply with, and it's my expectation that they comply with this to protect not only their employees, but their customers. And I know that Oregonians will literally vote with their feet. They will go to businesses that are taking extra efforts to ensure that their customers and their clients are safe and protected from COVID-19.
Thanks, Kelly.
Thank you.
Next up, we've got Lisa Balick from Coin. Go ahead, Lisa.
Good morning. Question for the governor to follow up, actually. Governor, what should a business owner do when they're forced to confront someone who refuses to wear a mask?
So I think those are really good questions, Lisa, about what the business owner response should be. And my encouragement to the business owner is to de-escalate the situation, to again ask the customer or the client to wear a face covering. It's obviously helpful if businesses have those available. We're working to get more of our personal protective equipment out to particularly grocery stores around the state, but other businesses as well, and to de-escalate. Businesses run into these difficult situations all the time. I want to ask people to use common sense and to be respectful of both the business owners, the staff, and of course, customers and clients.
But can they call the police if they want that person out of there if they're not wearing a mask and refuse to put one on?
Look, our law enforcement have a number of important things to do, and ensuring that people are safe is one of them. We are not asking businesses to call the police. If they need assistance and advice, they should call Oregon OSHA.
Thanks, Lisa. Next up, we have Mila Mimica from PGW. Go ahead, Mila.
Hi, Governor. I was wondering, with this rise in cases, are you considering reversing any aspects of reopening from phase one? Things like eating indoors or opening up boutiques, things like that.
So my goal in taking what I consider to be a very difficult step to require Oregonians to wear face coverings is to avoid what I would consider much harsher action, including closing down businesses. This is a serious request to ask Oregonians when they are going out in public to wear face coverings. It's going to require a culture change, and it's going to require a collective effort. We are all going to have to participate in this. Assuming we can continue to slow the transmission, then my hope is that we don't need to take further drastic steps. But Oregonians are watching what's happening in states across the country, from Florida to Texas to California. If we cannot slow the spread of the virus, we will need to take more drastic steps. That's why I'm taking this initial step of requiring and ordering Oregonians to wear face coverings when you're out in public, and in particular in indoor spaces. I should say indoor public spaces.
Next up, we have Ivy Green from the Oregonian. Go ahead, Ivy.
Yeah, a two-part question, Governor. Today you had said that you aren't requiring masks for children 12 and under. The document that your office and the OHA released yesterday says two things. I just want to be sure I have the age right. It says under 12 are not required, and then later on it says 12 and under are not required. Which is it?
I'm going to let Dr. Seidlinger answer that very difficult question.
Thank you for Thank you, Amy, for pointing that out. I think children under 12 are not required to wear masks. We know that children from 2 up to 12, with the assistance of a parent, can wear a mask safely, but it's not required for them to do so. Children under 2 should never wear a mask.
Amy, I would just add that
11 and under.
under 12.
Up until they turn 12, correct.
And I just want,
11 and under not required.
I mean, I just want to add as well, we really encourage, and I know a lot of parents are encouraging their children that are older than 2 to wear face coverings. It's obviously recommended, and if parents can make that happen, that's great. I know folks have been incredibly creative in terms of the types of face coverings they're making and creating for children and young people to wear.
Okay. So the second part of my question, you may have read, one of my colleagues in the Oregonian wrote today that coronavirus cases have increased by 5-fold among children under 10 during the month of June in Oregon. You may have also seen that the CDC and the American Academy of Pediatrics both say that children under 2 should not wear masks, but that children over 2 can safely wear masks. Why not follow that guidance that children 2 and older can wear masks? And why not require that, given the increasing rates of children being infected?
Thank you, Amy. I'm going to turn that one over to Dr. Seidlinger again.
Thank you, Governor. I think we encourage, all Oregonians who can wear a mask to wear a mask. So children over 2, and even those children from 2 to 12, if a parent can work with them to safely wear a mask, we would recommend that. We're not requiring that in indoor public places because different children have different abilities to wear the mask and wear the mask safely. But we all, as Oregonians, have a job to do in protecting each other, and so using a face covering, wearing a mask is important. You're right to point out that cases are increasing in children as they are in young adults and middle-aged adults under the age of 50. We're seeing this through workplace outbreaks, and those workplaces can spread in the home when parents come home, and that's where we see the vast majority of children who are infected. We're also seeing those young adults get infected at social gatherings, getting together with friends and families. So yes, we're seeing a change in who is getting infected with COVID-19, and that's why we need this message to go out to everyone to take steps to protect themselves, and especially those children who are in the household. We need to take these actions together.
Thanks, Amy. Next up, we have Les Seitz with the Malheur Enterprise. Go ahead, Les.
Governor, I think it was Dr. Seidlinger mentioned that the cases in central and eastern Oregon are particularly increasing, and that's especially true in Malheur County. In early May, the Oregon Health Authority issued, for what should happen after the opening, and it essentially classified it as stop, watch, and redirect. Listed a number of metrics. In counties like Malheur County, the communities have punched way past those metrics set by the health authority that was supposed to trigger some significant reassessment. So at what point does the health authority and does your office actually take action when you are seeing these numbers in your county far exceeding what the standards are?
So thank you, Les. I will just say generally in terms of my decisions to take actions will be based statewide on a combination of several interrelated factors because no single metric alone will give us the full picture. We'll be looking at hospital bed capacity, positivity rate, and the amount of community spread. I work with my medical advisory panel. They help inform my decision making and work closely with the Oregon Health Authority. I will turn it over to Dean to answer, Dr. Seidlinger, to answer specific questions about the metrics in Malheur County. We struggled a little bit to hear you, so he may need you to repeat the question, or at least a part of it.
Thank you for that. I think, we do look at those metrics on a regular basis and update them publicly on a weekly basis. In Malheur County, as well as some of the surrounding counties, what we're seeing is some of that increase in cases is driven by outbreaks in workplaces. And so the Oregon Health Authority, our Public Health Division, has been reaching out to Malheur County, providing additional resources so that we can help investigate these cases and contain the disease. We can see very impressive increases in percentages in smaller counties, particularly counties that haven't had significant disease before then. And so we work county by county, region by region, and across the state to assess the metrics, to bring the resources we need to help control the virus, to look at hospital capacity to make sure that Oregonians can receive the quality care that they deserve. But we need everyone to take a part. We need people to follow guidance, avoid crowds, keep your distance, and wear a face covering. We need people to cooperate with public health when they call. If you have COVID-19, stay home while you recover. Talk to the public health investigator who calls you about what you need to make that happen. Do you need help with food, with housing, or other things? If you may have come into contact with someone who has COVID-19, you'll also get a call from public health, from a contact tracer. They will ask you a series of questions about how you're feeling. They will ask you what you need to stay home so that you can prevent spreading the disease to someone else in case you get sick. By working together with public health, by taking those steps, we can control the spread of the disease. And the Oregon Health Authority, our local public health and tribal health partners are coming together to respond to places like Malheur County, places where we're seeing increased cases, so that we can try and work with Oregonians to prevent the spread of disease and to prevent more interventions from being done that would control the spread of the disease. So let's work together.
If I may follow up, Governor, with a clarification. In your opening phases, the decisions were made county by county, but I thought I just heard you say that any decision to reimpose harsher restrictions would be statewide. Is that correct? That any move to reduce accessibility, as it were, would be made statewide and not on a county basis?
I think, Les, I was focused on on a statewide basis. There's no single metric that I will look to, but looking at a number of interrelated factors in terms of shutting down. In terms of closing down a particular county or region, I think it just depends on what we're seeing on the ground. As you know, I don't know that Oregon was the first, but we did sort of brave a path forward in terms of opening county by county and region by region. I would anticipate, I think our hope is, should we continue to see increasing spread of the virus, depending upon where and depending upon what we're seeing, I would anticipate that we would use either the regional, the local approach again, or a statewide approach. It all depends upon what we're seeing and what the factors are, honestly.
Thanks, Les.
Thank you.
We'll go next to Nick Plotnick with Portland Review. Go ahead, Nick.
Hi there. Can you hear me?
Yes.
Great. Thanks. Thank you, Governor, and everyone. Governor, the governor of Texas has publicly said that he regretted reopening, the pace of his reopening, specifically on bars. I wonder if you have any regrets. We had previously written about how public records showed that Dr. Seidlinger had advocated for reopening at some point between May 15th and June 1st, and the longer you wait would have been the better in terms of bringing that downward curve even further down in terms of new infections and making the disease easier to control. Do you regret not waiting longer before reopening?
No. Here's what I do regret. I know, we all know now that this virus has impacted our communities of color substantially disproportionately than the Caucasian, than the white population. And I regret that we didn't see that at the outset and spend more of our time, our energy, and our resources focused on meeting the needs of our African American and Black communities, our Latinx communities, and our Native American and Pacific Islander communities.
Thank you. And a quick question. on health-related issue, not directly or not on coronavirus, but if I may, Mayor Wheeler and Councilor Daly have pulled their support on the Rose Quarter project. Are you having second thoughts about that project? Where does that stand in your plans?
Thanks. And Nick, I want to go back to your COVID-19 question again. We knew when we began the gradual reopening process that we would see increases of the virus. I think we didn't know what the level would be. Our modeling didn't take us that far out. And that's why I think it's so important right now that everyone in Oregon, as they go out in public and go into public indoor spaces, wear the face coverings. The science is really clear right now, and folks need to get on board with this collective effort. In terms of the Rose Quarter, I think we all we need to take a look at all of these transportation projects in light of the economic disruption that we're seeing statewide and frankly nationally. That said, we're not going to proceed with this particular project, with the Rose Quarter project, without community support and engagement from the Black and African American community. It's my hope that this particular project can be part of righting historic wrongs, and I'm committed to bringing people back to the table for that discussion.
Thanks, Nick.
Thank you. Thank you.
Next up, we have Gary Warner from EO Media. Go ahead, Gary.
Sorry, I had to get the mute button off that. I'm sure you saw the press conference outside yesterday with Governor Inslee in Washington when he was in the Tri-City area. There are certain people who see this as a political issue. There are certain people who are just not going to listen to the message that you have, at least coming from you or people that they perceive as being on the liberal side on this. What are you doing to diversify the people who are putting the message out? Get to these communities where there is this opposition and flip it.
Great question, Gary. I think it's really important that we hear from a diversity of voices about the importance of wearing face coverings. I know that folks at our University of Oregon Ducks teams are stepping up. Our folks at our Oregon State University Beavers teams, don't worry, I wasn't going to leave them behind. And that our Timbers and Thorns have stepped up to help relay the message. I was on a call Monday morning with public health officials from all across the state. I know they're going to use their voices and their expertise. And then we're going to continue to turn to our experts, our medical health professionals. These folks are clearly, truly on the front lines of this pandemic. I remember a situation in Central Oregon earlier on in this crisis when someone had a barrel racing event on private property in violation of my order. In talking to the doctors and the nurses at St. Charles, they felt personally attacked by those actions. And it's so important if we want to preserve our fabulous doctors and nurses and their ability to provide services to Oregonians that we keep our virus numbers down by wearing face coverings. Dr. Edwards, you want to add anything?
I will. Thank you, Governor. I'd like everyone to know that one of the wonderful opportunities, actually, that COVID-19 has presented has really been improving the communications and the working relationships of all of the hospitals and healthcare systems across Oregon. I can tell you that weekly we have a chief medical officer state call that involves as many of the CMOs as are available on a Thursday evening at 5 p.m. to gather and talk for an hour or more about COVID-19, the impact that it's having on our communities, on our hospitals, and how best to have this conversation with the communities that their hospitals and their health services are in. We've actually spent the last 2 weeks talking about this specific subject, which is for all of the different types of people in our communities. How do we best get out the public health message that wearing a mask, physically distancing, and hand washing is how we prevent the spread of this disease? The medical evidence supports that. So in answer to your question, I can specifically let you know that all of the CMOs are asking the question, who are the best people in our communities to get this message out so that it's not being perceived as coming from one group or another, but rather from the members of the community themselves?
I'll just add one more. We're also working with faith leaders. I know that faith leaders across the entire state of Oregon are working hard and using creative and innovative techniques to protect their members, including wearing face coverings. And so just want to appreciate their leadership and efforts to help ensure that folks across the state are being safe.
Thanks, Gary. We have time for just a few more questions. We're going to go next to Brad Schmidt with the Oregonian. Go ahead, Brad.
Governor, I'll go to the first one. When specifically, if ever, did OHA recommend to you that masks should be a statewide requirement?
Brad, I think your question is when did they recommend that it be a statewide requirement? I don't specifically have a memory of that. Maybe Dr. Seidlinger said something. I don't remember that.
No, thank you, Governor. Thank you, Brad. I think, wearing a face covering, some of the other actions we've talked about, keeping a physical distance away from people, avoiding crowds, are topics we talk about at all of our gatherings about ways to spread the disease. As the disease, became more prevalent, that certainly became one of the tools we talked about, not on a specific date or at a specific time, but as a response that we could all do together to this virus and the continued spread in Oregon.
Okay. The second part of the question is, you said that you'll look at a variety of metrics and making a determination if we need to slow or stop some of the reopenings that have happened. The metrics that you guys have used previously, you're not meeting. You're not meeting timeliness for tracing. You're not meeting hospitalizations, which are on an uptrend. You're not meeting the benchmark set for community spread. You're not meeting increasing case counts, and you've reported that the percent positive has not gone up, but the recent numbers that it is. So taken in totality, I guess what more specifically are you looking for to institute closures once again?
So thanks, Brad, for the question. No single metric alone will give us the full picture of what's happening. It will be obviously a combination of several interrelated factors. I will be looking, as I've said before, at hospital bed capacity, positivity rate, which we know is increasing, and the amount of community spread. I am in regular contact with Dr. Seidlinger and folks at the Oregon Health Authority, and my medical advisory panel is meeting on a weekly basis. I look to them for information and evidence as we move forward. I don't know if Dr. Seidlinger wants to add anything to that.
Thank you, Governor Brown. I think, as you've heard, we look at these measures holistically. We look at the resources we have and whether we can meet the spread of the infection here in Oregon. Most importantly, we want to make sure that the sickest people, those who need hospitalization, can get the care we need. That's a lagging indicator and one of the last things we'll see, and that is ticking up slowly. The requirement we now have statewide to cover your face, to wear a mask, is going to help slow the spread. And we hope to be able to see that in the coming days and weeks as we look at our metrics. Our public health colleagues at our local and tribal public health authorities have been doing a tremendous job of mobilizing additional resources of even in spite of the increased case counts, most counties are meeting the metrics of timely contact with individuals. And statewide, we're just about there. We know that, we need to mobilize more, and we're working with our academic institutions to bring on additional resources to meet that need. As of now, we continue to do those investigations to try and cut down on community spread, to keep people home when they're sick, to keep those people home and in self-quarantine while they're potentially could become infectious. But we need everyone to work together. So we look at all these metrics regularly. We look at them daily. We look at them more than daily, and we provide updates to Governor Brown and her staff so that we can see, do we need to do more? And that's why we're out here right now talking to you about the need to do more, to follow the requirement that we all wear masks in indoor public places, to reconsider your 4th of July plans, have that smaller gathering, keep your barbecue local, really local, like your backyard or your patio. Together, if we take these steps, we can prevent continued exponential spread. We can prevent our hospitals from not having the beds and the staff they need to care for people. So we'll continue to do this. We'll continue to monitor this, but we want to look at the whole picture and not just one metric, not one data point, but look at how each county, how our regions, and how our state is doing, so that we can safely get through the summer and into the fall.
Hang on just a minute. Do you want to?
To the point that Dr. Seidlinger is making about following a multitude of metrics, I think it's also important to remember something that we have been talking about for a little while, but it's easy to forget in all the months of COVID-19, is that it actually takes 2 to 3 weeks from the time that an intervention is put in place until we see the effect of that intervention. I think that we would all like to take these measures step by step and understand what impact putting something in place now may have on what we then look like in 2 or 3 weeks. We know, looking at statistics over the past several weeks, that mask use and physical distancing is decreasing among Oregonians. And this is probably a little bit a component of what's gotten us to where we are today, based upon our behavior over the last few weeks. So seeing this trend, if we can call this out and recognize that now is the time to put on the masks and the facial coverings, now is the time to get back to the physical distancing and keep going with the hand washing, that might be, we'll see, but that might be an important intervention to get us where we need to be 2 to 3 weeks from now, such that we don't need more severe interventions. But we can only know by making these things step by step.
Thanks, Brad. We have time for just 2 more questions. This one comes to us from Tim Gordon from KGW. Tim asks, if it comes to enforcement, what does that look like? Also, what's your concern and what's the proper focus to work with the homeless community?
In terms of enforcement, again, we're working collaboratively with the business community to make sure they have the tools and resources they need to comply. It's about protecting their employees, and it's about protecting their customers and their clients. As I said earlier, my executive orders are enforceable by law, but we shouldn't have to be in the position of calling the police to enforce face coverings. It's just common sense, folks. And want to encourage, again, Oregonians to, as they go about their business, to wear their face coverings. Your local businesses that you love, your local coffee shop, your local brew pub, your favorite boutique will only stay open if you take precautions. They will only be able to stay open if you take precautions. So stay safe, to stay open, wear a face covering. The second part of the question I lost. Oh, housing for our houseless population. Look, we are continuing to work to get resources on the ground to our community action agencies across the state. really grateful for the legislative action that that the legislature took a couple of weeks ago through the emergency board allocation to our agency, Oregon Housing and Community Services. These resources on the ground can really make a difference to assist with rental payments, to assist with houselessness prevention, and we're working to ensure that counties around the state have additional resources to assist with putting folks who are houseless into local hotels or other facilities so they can stay safe and COVID-19 free.
Thanks, Deb. And we have time for just one more question, so we're going to go to Julia Silverman with Portland Monthly. Go ahead, Julia. Are you there?
Sorry. No, I'm here. Sorry about that. Governor, I'd like to ask about how this week's information about outbreaks in child care centers might inform your thinking about schools reopening in the fall. Thank you.
Thank you. I am obviously sending the alarm with the statewide face covering mandate. We are letting Oregonians know if we can't slow the transmission of the virus, we will need to shut down businesses. I'm obviously concerned with school right around the corner. In terms of the outbreak at the child care facility in Lake Oswego, I think it's critically important, and I have directed OHA to make sure that they are not violating any patient privacy laws. There's obviously strong interest to notify the public quickly about these outbreaks. Both OHA and the Early Learning Division are updating their protocols to report these outbreaks. But the harsh reality is we have to stem the transmission of the virus. The best way to do this is through wearing face coverings when you go out in public and when you are in public buildings. Your actions will determine whether our businesses across the state can stay open, and your actions will determine, frankly, whether we can open schools in the fall.
Thanks, everyone. That's all the time we have for questions today.
Thank you.